gentlemen. I hope everyone's doing well. My name is Dale Moses. I'm the Community Support Services Infection Prevention and Control Consultant. I provide support to community support services agencies or people or agencies within that sector of community support services in regards to infection prevention and control. Today's presentation is going to be on the 5 principles of infection prevention and control, and are all pretty much relevant, or it all is relevant for our sector in providing a safe workplace for our clients, our staff, our caregivers, and anyone that walks into any one of our facilities, so visitors. So without further ado, let's begin. Today's topics are going to be very general. When I say general, they're going to be all isolated or required topics for infection prevention control in our sector. So today's topics are going to be on additional precautions, PPEs, hand hygiene, environmental hygiene, which is cleaning and disinfecting, safe handling of waste and sharps, and respiratory hygiene. As we go through this presentation, the topics aren't going to be in exactly aligned orders. However, they will be touching upon all these 4 issues or objectives in the presentation. Additional precautions: airborne, droplet, and contact precautions. The routine practices and additional precautions deal with ways that we can help to keep our clients safe, our residents safe, and our employees safe. So hospitals provide care for sick people who may be at risk of getting sick or getting germs, or who have germs that can make other people sick. In hospitals, it's common for germs or bacteria to pass from one patient to another, a patient to a family member or other guests, or from a family member or other guest to a patient, or a healthcare provider to a patient, or a patient to a healthcare provider. We place all patients on something called routine practices, or then we provide additional precautions when providing care to these clients. This means that when we provide care for family members, we will clean our hands using hand sanitizer, soap, and water. We'll wear gloves and may use extra PPEs or personal protective equipment like gowns, masks, or eye shields. And I'm going to go into these topics, some a little bit more than others, but just to give a general idea of what we provide for our clients and our residents in our homes or in support services agencies or ADPs. So what are additional precautions? They're an extra practice that must be done when routine practices are not enough to prevent the spread of infectious diseases or germs. We place your family member or your client on additional precautions. So we have something called contact precautions, droplet contact precautions, and airborne precautions. And what are these? Contact precautions prevent germ spread by touch. So if you have, for instance, let's just say you have influenza, which also comes under droplet precautions, droplet contact precautions, we would ensure that you have gloves on. You may have masks on as well. But it's all dealing with contact or spread through contact with the person or contact via, call it fomite, or any other material or a desk or an object. What we do is we try to prevent the spread of infectious diseases through those means. The other one is droplet contact precautions, and that's to prevent the germs in droplets spread by talking, coughing, or sneezing. So again, if a person's on droplet or contact precautions, we'd be wearing masks. In some cases, you might even wear shields, face shields. You may wear gowns. You'll definitely wear gloves. And again, we're preventing the spread of this organism or infectious disease through droplet contact precautions. And then we have airborne precautions, and a good example of this would be measles or tuberculosis. We're here to prevent the germs in the air from spreading by coughing or sneezing as well. And things such as measles and tuberculosis are highly infectious. So in a case like that, we would sometimes have places in hospitals called anterooms, where negative pressure, where you go into, you would sometimes you would ensure that you have your PPEs on as well. And the reason why we would have these anterooms is to prevent the air from inside that room coming outside because of the infectious nature of that organism. And then sometimes if we don't have the anterooms, because not every hospital or every organization has that, then we would have to have other ways in preventing the spread of this airborne disease. So when going into these rooms, you would wear a N95 respirator, again, anti-room, washing hands, gowns, face shields, and the person would be under some form of airborne precautions. Now, one of the biggest things that I like to say to everyone is prior to entering a room, as medical staff or as employees that deal with clients in the healthcare setting, we do something called a PCRA, a point care risk assessment, or just a risk assessment, where we sit down before we go into the room and literally sit down, but we assess what type of precautions are needed when handling this client. And again, just to reiterate and to reinforce the whole transmission, there's contact, droplet, and airborne. Again, contact, germs spread through direct contact between individuals, person to person, or indirectly through contact with contaminated objects. The environment, person, droplet being germs traveling 2 meters or more, or within 2 meters with coughing, sneezing, or talking. Good example would be influenza, even COVID-19. And then airborne, tiny germs dispersed widely by air currents. Inhale would be measles, tuberculosis, and those are two big ones that we know of as well. And again, hyperprotections, gloves and gowns for droplet, protection mask and eye protect. Sorry, gloves and gown for contact, mask and eye protection for droplet, and negative pressure N95 respirator for airborne. And again, pushing the whole additional precautions, contact precautions, droplet precautions, and airborne precautions. N95 masks for airbornes, regular medical mask for droplet, and a regular medical mask for contact precautions as well. Only thing is with contact precautions, we're definitely going to be wearing gloves, droplet gloves, airborne gloves, and gown as well, and may use other PPEs once the PCRA is done on that client. I'm pointing to care risk assessment. Some questions you might ask before you do a PCRA, and I love this slide, is what is the contact I am going to have with this client or a client's environment? Is there a risk of splash or spray? It's contact with mucous membrane, non-intact skin, blood, body fluid, secretions, excretions, or soil, or likely soil item surface anticipated. I'm not going to go through everything. Is the client displaying symptoms? Is the client able and willing to perform hand hygiene? And is the client fully vaccinated and tolerates the mask? So those are the questions you're going to ask when you do a point of care risk assessment prior to determining what type of PPEs to be worn in that room. And again, questions and answers to be asked. And I love this example. So in this case, a person's confirmed with laboratory confirmed influenza, currently ill with fever, runny nose, and a cough. Nurse Abby will be providing supportive care, such as taking the client's temperature and changing their clothes. What type of additional precaution should be? And I will give everyone some time to think that one out again. Again, the person's laboratory confirmed. They're definitely still ill because they have the fever, they have the runny nose, so they're symptomatic, still symptomatic, and coughing. So they're spewing the germs, 2 meters or more. What type of additional precautions or PPE should be worn when handling this person? And you're also going to be changing clothes, so there's going to definitely be some close contact between you and that person. And if you've guessed droplet contact precautions, you are correct. Droplet contact precautions would be met when handling this client. So medical mask, gloves, gown, maybe a face shield as well, would be worn when handling a person who is positive for laboratory confirmed influenza once a PCRE is performed. John has measles but needs medical support. What type of additional precautions would you use? And I'll give you a few seconds to think that one out. So again, John has measles, very airborne, very highly infectious, and needs medical support. What are you going to do? What type of, you're going to do your PCRA, your point care risk assessment, and what type of additional precautions would be? And yes, if you guessed airborne precautions, you're correct. We deal with measles and airborne infectious disease and highly infectious. And again, as I said, airborne, so airborne precautions would be used. So N95 respirator, gloves, gown, even facial as well, before entering that room. And in some cases, if you can provide an anti-room, even better. So what are personal protective equipment? How do we wear them? So I'm going to be going a bit through this very quickly. I should say very quickly, somewhat efficiently. We pretty much know what PPEs are. We've done this numerous times, and I'm sure everyone's using them, doing them, and using them correctly to this point right now as well. So personal protective equipment are gowns, gloves, mask, eye protection, and in some cases, not in some cases, in all cases, N95 respirators as well. When would you wear these and why? You know the answers to them. So to protect yourselves from infectious secretions, protect yourselves from clients who are ill, protect clients from us, because we may be ill. So it's worn to protect both client and healthcare workers. Um, Choice of PPE is based again, as I said, on the nature of the interaction. So we all going to do a point of care risk assessment. What is the likely mode of transmission of infectious agents, and your risk assessment, which we just done in the previous slides. That's how we're going to understand. Who's responsible for this? I like using this slide all the time because it allows you to know that the employer should provide appropriate PPE suitable to the task, provide quick and easy access to PPEs, have guidelines on PPEs in place, train healthcare providers on appropriate PPE use, and evaluate the quality. And as the worker or the employee, your responsibility is to wear the PPE when required to protect yourself or the client, and a report to an employer or supervisor PPE is not available. It is not or it is if it is not appropriate for task or it for what it is used for, or if they're damaged as well. Accessing PPE without contaminating the container or other items is a must. Performing hand hygiene before putting on PPEs and after taking off PPEs is a must. And put PPE on immediately prior to each activity that it requires, as is determined by your risk assessment. Remove PPEs immediately after activity or task is done and when soiled or damaged. So understanding that you have to sanitize your hand prior to putting the PPEs. And the biggest one is before leaving that area or that room, the PPE or the dirty PPE should be left in that room. Do not wear your PPEs outside of the rooms or outside of the areas where you can potentially cause cross contamination, which I've seen before in the past. So always remember, don outside, doff inside the room as well. So you want to leave the dirty PPE in the dirty room or the dirty area that you're in. And here's a question for you. Prior to donning PPEs, a point of care risk assessment must be done to determine what PPE to wear or what PPE must be worn. Is this true or false? And I'll give you a few seconds to determine this one. And the answer is A, true. Point of care assessment must be provided prior to any PPE being worn to determine whether or not you're wearing the appropriate PPE for protection of yourself and protection of the client as well. Gloves. They protect our hands from contaminated equipment or environmental services. They protect our hands from infectious agents that may present in blood, body fluids, non-intact skin, mucous membranes, secretions, or excretions, and are available in many types and sizes as well. Choice of gloves. Latex gloves. Oh no, we do not want to use latex gloves. Powder gloves, that's a no-no as well. And copolymer sandwich gloves, those are a no-no too. Gloves are not providing, sorry, gloves are not providing direct health care, touch intact skin, and use social touch, example, shaking hands as well. Always change your gloves between clients and patient residents. Always change your gloves when you go from a dirty area or task to a clean area or task on the same client. Always make sure your hands are dry before. So always make sure your hands are dry before putting on those gloves. And always remove gloves as soon as the task. So as I said earlier on, as soon as that task is completed, ensure that those gloves are taken off so you do not cause cross contaminations or cross contamination. And here's a question for you. What type of glove would be better use in a medical setting? We have one, latex, two, nitrile, and vinyl. And if you said nitrile and vinyl gloves, you are correct. Those are the better choices of gloves to wear in the healthcare setting. All right, my favorite topic, cleaning and disinfection. And I love showing the difference between these two. So cleaning is the physical removal of organic materials such as blood, secretion, or microorganisms. Physically removes rather than kills a microorganism. And what do we use to clean? We use water, detergent, and the mechanical action, that friction that we use, that removes the organism off of the inanimate surface or the foam or the fomite. Disinfection now is a little different in that it's the inactivation of the disease-producing microorganism. Disinfection does not destroy bacterial spores. The items or surface must be free from visible spores. So kind of like washing your hands. We always say if you're or hand sanitizer, you have to wash them. The same thing with cleaning and disinfecting animate surfaces or fomites. You have to visibly, if the object is visibly soiled, you have to remove those organics because then if whatever you put on top of that to disinfect will not work. So you have to remove the organics, physically remove it, friction, soap, water, get it removed, and then disinfect the area. So if there's still organisms, infectious diseases on an inanimate surface or fomite, the disinfecting process will kill it. Again, when dealing with disinfectants, I know you've seen this numerous of times from me. You got to make sure it has a DIN, has to be with the expiry date, step cleaner disinfectant, short contact time, 5 minutes or less in medical care or in the healthcare setting, and wipe or squirt format, no spray bottles. And the reason they say no spray bottles, because if you're spraying that surface where the organism is and you're spraying that, what happens is you're aerosolizing the organisms and may put other people at risk of infection as well. So always remember that no spray, wipe, or squirt format. And a great example, I love showing these, is Lysol, 6-minute contact time, great shelf life, and a great disinfectant, benzyl ammonium chloride. My favorite Cavi side or Cavi wipes, great disinfectant as well. Has a 1 minute, 1 minute, as it says, one Cavi wipes one, meaning 1 minute contact time. So always be cognizant of the contact times as well. So if the contact time is 1 minute, make sure that surface is wet for 1 minute to be able to provide proper disinfecting. So contact times are very important when disinfecting objects or disinfecting anything as well. When we're into cleaning, I like to talk about this too as well. Always making sure your supplies are assembled. Clean hand using ABHR priors, wear PPEs if it's required. Do an assessment. What type of cleaning or am I cleaning a washroom? Am I cleaning a room? Am I cleaning a hallway? Am I cleaning a work area where people sit down and type, where the administrative staff are? So you gotta kind of like a PCR with additional precautions. Same thing with environmental cleaning. What type of cleaning is going to be needed here? Cleaning from clean to dirty, high to low, top to bottom. Bathrooms are always last because they're always the filthiest. And a fresh cloth for each room. No double dipping, and the consider separate cloth for the washroom as well. Disposal. Separate dirty clothes from clean cloths, replace garbage bags, remove non-hazardous baggage, replenish supplies, perform hand hygiene, remove PPE and discard, and perform hand hygiene when leaving that area as well. Always making sure your hands are clean. And breaking the chain of infection. You're breaking that chain, infectious diseases to war reservoir. And I just wanted to give a quick brief here is that you're cleaning the area to prevent the spread of infectious disease from client or from inanimate surface to client or inanimate surface to employee as well. So this is a very important step for cleaning and disinfecting or for maintaining and keeping a safe home or a safe workplace or safe room as well. N95 respirators, medical masks, or surgical masks. Again, I love this slide. I show it all the time. And the reason why I show it is because I always get questions about what type of level of mask do I wear. And my quick response is those levels are just meant to deal with the issues or respect to fluid resistance. Has nothing to do with protection of infectious disease going through that mask. And as you can see, level 1 is for low pressure venous pressure splash. Level 2 is for arterial pressure splash. And level 3 is for high velocity procedures, orthopedic surgery, and things of that sort as well. Mask and respirators. A mask protects the nose and mouth from splash or spray or blood, body fluid, secretion or excretion, droplets from coughing or sneezing, clients, patients, or residents, is to be used when within 2 meters of a coughing client or resident with symptoms of an acute respiratory infection as well. And a respirator filters out small airborne particles, prevents inhalation of airborne infectious agents as well. And those are the N95 respirators that we mask test and that you have to be mask tested every 2 years as well for these. And again, as I always say, choice of mask is based off of your PCRA, your point of care risk assessment. Is it substantial enough to prevent the droplet penetration, securely covers your nose and mouth, and that can last for the duration of the activity? Those are things that you have to take in consideration as well. Mask as well. Client patient residents with new acute respiratory illnesses who are coughing should wear a mask if tolerated when they leave their room, if ambulatory clinics and doctors, when in ambulatory clinics and doctor's office or in the ambulance as well. Client patients residents should never wear an N95 respirator at all. And again, appropriate uses of a mask. Always remove a mask immediately after the task has been completed. Always wear a mask that fits your face properly, and always discard the mask after it's been used. And I love these photos. Never wear it underneath your chin. Do not touch your mask all the time, and definitely don't put your used mask in your pocket. That's going to contaminate your pocket, your hands, and if you put it into your pocket, you're going to be contaminated. So do not put your mask in your pocket, please, and thank you. Proper way of wearing your mask. Again, it has to cover your entire face and your nose and the bottom of your chin. Should not be too high above your chin. Should not be underneath your nose, and it should not be worn around your chin. So just things to be cognizant about when wearing masks as well. And put on your mask. I'm not even going to bother going through this. I know everyone here has been trained to the T and how to properly put on a mask. We all know to wash our hands. We know how to put it around our ears, squeezing the top, making sure it covers our entire nose and chin. And when taking it off, how to properly take it off too as well. But this diagram is provided if you may need a refresher, which is perfectly fine. Not everyone here wears masks frequently as well. So yes, please understand how to put on a mask and how to doff it as well properly when using them in the workplace. Face shields and eye protection. Again, I'm not going to stay on this too long. Facial protection consists of a mask and eye protection, protects eyes, nose, and mouth from droplet contacts with infectious diseases. Protects the eye protection, protects your eyes. Our glasses aren't considered eye protection, so please don't wear your glasses think it's protecting your eyes because you can get splashed from underneath, above, or to the sides as well. And again, as I said, always choose eye protection based on your PCR. So point of care risk assessment has to be completed to ensure that the eye protection is needed. And when using eye protection, make sure it's also clean and disinfected prior to use. And like with anything else, ensuring that your hands are sanitized prior to putting it on, and ensuring that if you're going to be reusing it, it's disinfected, put in a clean and safe area, won't be cross-contaminated as well. And once doffed, to ensure you're disinfecting your hands as well. And as I mentioned, eye protection should not be worn on top of your head. Your glasses aren't your eye protection, and do not disinfect or reprocess disposable eye protection. However, during COVID, because procurement of eye protection was near impossible, to ensure that everyone had something, we did reprocess of them during COVID. We'll say, hey, you know what? We need to do what we have to do to protect our clients and protect ourselves. Gowns, again, point of care risk assessment must be done prior to wearing a gown. Must be appropriate to the task based on the risk assessment. Must be reusable or disposable. I have quite a few reusable gowns. If anyone's looking for a box of them, let me know. I still have quite a few. Must be long sleeve with cuff. It must offer full coverage of the body front from neck to mid thigh or below as well. Not to be worn to stay. Not to be worn to stay warm. Should be hanging them up. If they're disposable, I don't wear them out of the room. Once you're finished using them, with all the other PPEs, they have to be discarded after use as well for protection. And again, just pushing that whole premise on PPE, sure that everyone understands they protect patient to patient, patient to healthcare worker, healthcare provider to patient, and healthcare provider to healthcare provider. Is used alone or in combination as well. And again, the whole purpose is to break the chain of infection. So cleaning and disinfecting does it, wearing PPEs does it, proper hand hygiene does it as well, breaks the chain, and also vaccination, which I'm just going to touch upon very briefly at the end of this. And the reason why we have all these different types of protective measures, and I love this slide because it's the Swiss cheese slide. As I tell everyone, I'm an airline pilot as well. And we always talk about this Swiss cheese method, meaning that the more barriers that we put up, the less likelihood we'll have an issue down the road. So cleaning hands, masking, physical distancing, ventilation, staying home and sick, and vaccination all help to provide a mode of protection, which is the Swiss cheese model as well. Hierarchy of controls, PPE being the bottom, and elimination or removal of the hazard at the top. We have a lot of engineering controls that are implemented, which is ventilation, cleaning, and disinfecting, administrative controls, which are physical distancing, vaccination programs, and at the bottom, which is the bottom pinnacle, PPEs, mask, respirator, gowns, gloves, and eye protection as well. Safe handling of waste and sharps. So medical waste includes sharps, infectious materials, pharmaceutical and chemical waste. Safe handling prevents infectious transmission, environmental contamination, and compliance with local, national, World Health Organization guidelines is mandatory. What do we do with segregation classification of safe handling of sharps? Is segregate waste at the point of generation. Use color-coded bins. Red for infectious, yellow for sharps, black for general. Label containers clearly with hazardous symbols. So sharps containers is a great example. And train staff on proper segregation practices. When dealing with sharps, it's great to have a sharps container and understand how to use them. But when they get filled, calling the pharmaceutical company or dropping them off, handle them safely, drop them off at the local pharmaceutical company helps to alleviate any of the risks. One of the things I always train people when putting out garbage, especially for environmental staff, don't put your hand in the garbage. Never put your hand in the garbage or blow it out, blowing the air from inside that garbage out of the top. Again, you're putting yourself at risk of being infected, and you're putting your hand in a garbage bin where there's a slight likelihood someone could have put a needle. You're putting yourself at risk of a needle stick as well. So always train staff on proper mitigation of that risk. Always wear appropriate PPEs when handling waste as well. Use puncture-proof sharp containers. Never recap needles. Transport waste safely to designated storage area and ensure timely disposal via incineration, autoclaving, or approved treatment method as well. Some places use autoclaves. Autoclaves usually have to be challenged. So if you're using autoclave for anything, ensuring that it's challenged physically, chemically, and also documentation as well to ensure, and biologically, ensuring that it works and that whatever is being reprocessed through those autoclaves are passing those three criteria of physical, chemical, and biological testing to ensure that autoclave is working as well. Regular audits and monitoring for compliance, staff education, refresher training, which is great documentation reporting, which I said is that physical way of documenting that things are being safely disposed of. Move towards eco-friendly disposable methods such as waste minimization or recycling where safe as well. And if you have any questions regarding this, please feel free to give me a call. I like this topic. It's very interesting. Again, I used to do a lot of audits in tattoo parlors and medical facilities where I dealt a lot with the reprocessing and handling of sharps, which is a very interesting topic. And if you need any more information pertaining to this, please feel free to reach out to me to discuss this as well. Hand hygiene, our favorite, the single most effective way, the single most effective way of preventing the spread of infectious diseases, all in one big mouthful, is hand washing. Using liquid soap and water should be used when hands are visibly soiled. Alcohol-based ABHR should be used when hands are not visibly soiled. Hand hygiene should be performed for at least 15 seconds and prevent dryness by using a scent-free moisturizer after performing hand hygiene. And again, what we're trying to do is kill any of those bad microbes, Staphylococcus aureus, E. coli, 0157, anything that's out there. Our bodies typically have Staphylococcus aureus on the skin or Streptococcus pyogenes. It's just one of those things that tend to be on our skin. But by cleaning our hands regularly, you prevent the spread of other infectious diseases. And this is from the London School of Tropical Medicine. That's where I was doing my master's. Really good school. Um, uh, Really good topic with common microbes is that if you have a break in your skin, you stand the risk of infecting that. For instance, when I worked in public health, we dealt with something called group-based strep, which is caused by a organism called Streptococcus pyogenes. And what used to happen, and that's a typical strep throat organism or bacteria that causes strep throat. And when you have a break in your skin or break in any part of your body, immunocompromised, that would sometimes cause another organism, something called flesh-eating disease, necrotizing fasciitis. Um, and our biggest thing was ensuring your hands are washed frequently and ensuring that cuts are cleaned and covered frequently as well. So again, washing hands are very important. Good hand washing can prevent diseases such as shigellosis, Shigella soni, E. coli, streptococcal diseases, influenza, and the common cold as well. 4 moments of hand hygiene, which we should know is before initial client environment contact, wash your hands, sanitize your hands. Before aseptic clean procedures, wash your hands, sanitize your hands. After bodily fluid exposure risk, again, wash your hands, sanitize your hands. And after client environment contact, leaving the client's room, leaving the home, ensure your hands are washed and sanitized as well. How many times do you wash your hands or use alcohol-based hand rub sanitizer throughout an average work day? And this is a question. Let everyone think about it. But I'm sure you probably wash it more times than you can count, especially in healthcare. And that's a good thing if you can't remember because you should be washing your hands very frequently. And a quick question. Washing your hands is the single most effective way of preventing the spread of germs. True or false? The answer to that is true. Wash your hands is the single most effective way of prevent the spread of infectious diseases. What I just said at the beginning, that was definitely true. Now, influenza, COVID-19, and RSV, I am not going to be touching on this too much. I just want to just throw this in here and let everyone know that the vaccine is free of charge right now. There are also antivirals for these as well for influenza, COVID, and RSV. Immunization clinics can be scheduled at your local health units and local drugstores. I don't think, yeah, local drugstores. And again, let's stay safe. Let's get immunized. Let's pass this on to everybody and ensure that everyone is safe and protected from any of these. I call them the three deadly horsemen: influenza, COVID-19, and RSV, and ensuring that we are safe and protected ourselves as well. And thank you.